Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Imo, Bauchi and Cross River States take delivery of Moderna and AstraZeneca vaccines as they flag off second phase of the vaccination exercise. Ekiti COVID-19 task force visits public spaces to enforce adherence to safety protocols in the state. And Australian Prime Minister Scott Morrison says Australia must start to live with COVID-19 when higher vaccination targets are reached. And COVID-19 is not malaria. A message from the Nigeria Center for Disease Control, NCDC, on how to differentiate between the two diseases. According to the agency, if you have a cough or are feverish with any of the following symptoms: loss of taste, smell, difficulty breathing, diarrhea, catarrh, fatigue, shivering, body pain, headache, sore throat, then you should stay at home or contact your state Ministry of Health. The center, which continues to monitor the response, also announced 388 cases on Sunday, putting total confirmed cases at 187,023. Here's more on the report.
In the last 24 hours, Nigeria witnessed a decrease in its daily COVID-19 case count as the NCDC announced 388 confirmed cases reported from 11 states and the FCT. Lagos had the highest numbers with 166 cases, followed by Akwa Ibom with 89 infections. 76 cases were recorded in Rivers. Oyo had 15. 12 cases were reported in Edo, while 11 cases were reported in Benue. 7 cases were registered in Delta, 4 cases reported in Ogun and FCT. Kaduna had 2, while Gombe and Nasarawa registered 1 case each. There were 0 cases reported from Ekiti, Kaduna, Kano, Ondo, Plateau and Sokoto states. The latest update also includes a backlog of data for Benue State and confirmed cases from Akwa Ibom State. The overall count of confirmed cases in Nigeria now stands at 187,023. 135 people have been discharged in the last 24 hours, increasing the total number of recoveries to 168,455. The NCDC says 8 people have died from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,268. Presently, there are more than 16,000 active cases in Nigeria, while over 2.7 million samples have been tested so far. In Africa, there are over 7.5 million confirmed cases and more than 189,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 211 million, while more than 4.4 million deaths have been reported.
And to achieve herd immunity against COVID-19, Nigeria set the goal of vaccinating 40% of its over 200 million population before the end of 2021 and 70% by the end of 2022. But this was before vaccine nationalism. However, the National Primary Healthcare Development Agency rolled out the first phase of vaccination when almost 4 million doses of the AstraZeneca vaccines Covishield were received in March, starting with health workers, COVID-19 rapid response team, laboratory network, security agencies and strategic leaders. And now, with the new batch of Moderna, J&J and AstraZeneca vaccines in the country, some states are already taking deliveries and flagging off another round of vaccinations. Let's take a look.
Officials of the Imo Primary Healthcare Development Agency at Sam Bakwe Airport in Owerri, the Imo State capital, are here to receive their own consignment of the Moderna and AstraZeneca vaccines. A representative of the state government says all modalities have been put in place to ensure that the vaccination program is simplified to reach the rural areas across the 27 local government areas of the state.
We have fixed posts and temporary posts, and we are going also to go to all the primary healthcare facilities and some centers, like temporary posts that we created. So the last time we were going to churches and schools, but now we are going to make it as a sort of routine immunization. So we will encourage people to go to the facilities and and get their own vaccines.
Cross River State appears to be ready for the second phase of the vaccination exercise, as some residents are on ground to get shots of the newly received vaccines. At the flag-off ceremony, the Director General of the State Primary Healthcare Development Agency gives a breakdown of the shipments received.
Development Agency sent us 105,000 doses of the Moderna vaccine and 11,000 doses of the AstraZeneca vaccine. For the AstraZeneca vaccine, it's only for those who have had the first dose, then the Moderna, of course, for first-timers.
Given the rising number of cases in the country, the State Commissioner for Health is asking residents to ensure they get vaccinated against the virus.
Cross Riverians, you have been very topmost on prevention. You have adhered to all the instructions which we have given. It's time to come out en masse and get vaccinated, and let's get protected and see how we can work towards getting herd immunity.
Bauchi State has also joined other states to roll out its vaccination exercise. At the official campaign flag-off, the Deputy State Governor, who is also the chairman of the State Task Force on COVID-19 response, tasked health workers to ensure equitable distribution of the vaccine across all the local government areas.
We're using the Moderna vaccine. This is one of the approved COVID-19 vaccines that is being used globally. Bauchi State, as mentioned by the chairman, has received about 100,206 doses of the vaccines to be given in 114 centers across the 20 local governments. And unlike the first phase, this phase of the vaccine targets the general public. The first one, we targeted the health workers, the people in authority that can give directions and things like that. But this one, we are targeting everybody, generally, the general public from 18 years and above.
While the call for more Nigerians to receive the jab resonates, the arrival of these vaccines will support the federal government's drive towards bringing the pandemic to an end.
Meanwhile, in some states in Nigeria, persons living with disability appear to be faced with challenges due to the outbreak of the coronavirus pandemic. While in Lagos, they lament the lack of access to COVID-19 vaccines. In Abia State, they appear to be faced with the challenge of maintaining the COVID-19 protocols and daily upkeep.
The World Health Organization says people living with disabilities have been amongst the most vulnerable populations in the current COVID-19 outbreak. That's due to many health, social, and environmental barriers, discriminatory attitudes, and inaccessible infrastructure. With vaccination being rolled out around the world, Lagos, Nigeria inclusive, some groups have raised concerns about how they have not been prioritized in the exercise.
Lawmaking, oversight, and
one of such is the Center for Citizens with Disabilities. According to them, they have been excluded from access to COVID-19 vaccines.
I expect that even if it's not going to be available, that any of the directors responsible for that should equally come here to hear direct, so they can be able to have a deeper knowledge about what to do. But we couldn't. The Primary Health Care Board, their absence here shows that they don't care.
The group is calling on relevant authorities to implement the recommendations reached at this meeting.
We are happy that the Commissioner for Information graciously said, this is important to me. Let me know what is going on here. Let me see. And he dedicated a senior officer to come here from beginning to the end. That is how you know ministries and agencies that prioritize issues of disability.
It is a similar scenario in Abia State, as persons living with disabilities lament the difficulties they experience as a result of the pandemic. They say their struggle is compounded by lack of access to vaccines.
Actually, persons with disabilities are always isolated. So during that COVID-19 era and vaccination of COVID, you get to find out that most persons with disabilities, we tend to be queuing for a long period of time, waiting for everybody's citizens to get vaccinated first. But first thing first, persons with disability needs to get priority, preferential treatment in everything.
Within the period the COVID-19 was so intense in the country, most of my people lost their lives because of abandonment, neglect, and rejection, because of sit at home. Most of them that don't have assistants, helpers that would go errands for them, and those that doesn't have money to stock food in the house, it was not an easy task.
With the respiratory illness still potent in the country, and as some states begin vaccinations, an inclusive dispatch of the vaccines becomes all the more important.
More on the situation with the vulnerable group. Joining us from Abuja studios, Mr. Victor Owuyomi, Senior Research Program Officer, Center for Citizens with Disabilities. Thank you for joining us on the program.
Thank you for having me.
Just before we get to talking about access to COVID-19 vaccines, I'd like to know what impact the pandemic had on the vulnerable population, persons living with disabilities, especially since 2020. How much did life change?
Thank you for that question. Ordinarily, persons with disabilities are known to be facing a plethora of challenges prior to the advent of COVID-19. However, COVID-19, impacted negatively on their socioeconomic conditions and their psychosocial well-being. For instance, it increased hunger for many of them. Many of them lost their jobs because majority of them, from my research so far, are usually into informal sector of economy. And due to the impact of lockdown, many of them could not operate their different businesses. They were at home. A majority of them usually depend on caregivers. They depend on their dependents. And most of their dependents could not also go into their different economic activities. A majority of them also were affected psychologically. It increased their level of depression. It triggers schizophrenia among many of them, and it's also increased level of discrimination against persons with disability. So looking at the impact of COVID-19 pandemic on the life of persons with disability, it has a negative impact on their socioeconomic conditions and psychological well-being.
So quite an impact from what you've just listed. But looking at your recent study, what was the major finding as to why persons living with disabilities have sort of been alienated from accessing available vaccines?
Yeah, from the Center for Citizens with Disability recent assessment on access to COVID-19 vaccine among persons with disabilities in Lagos State, we find out that majorly there is no synergy between Primary Healthcare Board and the Lagos State Office of Disability Affairs, which has further institutionalized discrimination against persons with disabilities. We also find out that there is no commitment so far on the part of the Lagos State government toward disability issues, which is also affecting their access to COVID-19 vaccine. And we also find out that majority of persons with disability have a lot of misconceptions about the safety and efficacy of this COVID-19 vaccine, and this is also discouraging many of them from accessing the vaccine. And also we find out that majority of those who have accessed the health facility for this vaccine face a lot of challenges like physical barriers, they face attitudinal barriers, they face the lack of ramps, they face communication barriers like lack of sign language interpreters at the health facility centers, and even the attitude of health workers towards many of them was not so friendly. Why? Because many of the health workers do not have adequate knowledge about disability issues, about disability rights, about disability needs. So because of all of these issues, many of them were discouraged from even accessing the vaccine. And because of the information out there that is not well, well tailored toward informing
not
them
a lot of
properly
sensitization. But Mr. Owuyomi, I just want you
Yes.
to wrap up in 30 seconds if you can. What are some of the changes that you'd like to see going forward, seeing as we've started another rollout of vaccines?
Yeah, thank you very much. Like the changes that would like to happen on the area of these vaccines, since they are rolling on the second phase, is that government should try as much as possible to remove every environmental, physical, and attitudinal barriers that is preempting PWD, person with disability, from accessing the COVID-19 vaccine. And government should also try as much as possible to train the health workers on how to respond competently to the needs and rights of persons with disabilities in Lagos State and across the nation.
All right. We'd like to thank you. A good 30 seconds there. Thank you so much, Mr. Victor Owoyomi, Senior Research Program Officer, Center for Citizens with Disabilities. Thank you so much for joining us on the program.
Thank you very much for having me.
We have more on the global response to the pandemic when we return. Please stay with us. Welcome back. Staying in Nigeria, government has reawakened the COVID-19 enforcement machinery in Ekiti State, with the task force getting back to the streets to enforce adherence to the safety protocols. The task force over the weekend stormed some crowd-pulling facilities, which led to the closure of some banks, eateries and other outfits. Churches were not spared in the new monitoring enforcement, as Sunday services were also interrupted. Our correspondent, Babajide Agbeyo, tells us more.
With the evident manifestations of the third wave of COVID-19 in Nigeria and in Ekiti State, the COVID-19 task force is back on the streets to ensure enforcement of protocols. The task force has gone around over the weekend to inspect some supermarkets and places harboring large gatherings. And some banks were sealed, supermarkets as well, that were found airing.
Over the weekend, we visited a lot of business premises, and we realized that people have actually relaxed their protocols. So what we had done is to warn some places, some people, and the people that we have already warned, that we had warned before, and they have also not complied. We sealed up their business premises and gave them the protocol, to obey. We sealed the commercial bank and like about 2 or 3 eateries, and all of that. And of course, we had corrected them. We're not interested in running down anybody's business, but we're just enforcing. And as soon as they comply and have met all the criteria and everything, so we reopen them for business.
With the renewed enforcement, it is expected that those affected will adjust to the new realities. Babajide Agbeyo for COVID-19 update.
And the United States is fighting a major domestic health war against COVID-19. This virus continues to be one of America's greatest challenges. Here's our Washington correspondent, Maria Bird, with more.
The United States reaches death rates of over 1,000 people per day due to COVID-19. There are approximately 42 fatalities per hour. This type of devastation has not been seen since March of 2020.
The Delta variant continues to drive a rise in cases, with cases concentrated in communities with lower vaccination rates. In the past week, Florida has had more COVID cases than all 30 states with the lowest case rates combined. And Florida and Texas alone have accounted for nearly 40% of new hospitalizations across the country. We all know that vaccinations are the very best line of defense against COVID and how we end this pandemic.
Hospitals across the country, specifically in the southern region of the U.S., are being stretched thin as they fear not having enough resources to adequately care for the rapid increase of COVID-19 patients.
They've got 5 patients in their emergency room who are in desperate, urgent need of an ICU level of care. I want something. What I don't want is a request for 5 caskets, because I've had 5 people die while waiting for emergency health care.
COVID-19 is rapidly spreading amongst U.S. congressional members again, as 3 vaccinated senators have contracted the virus. This further supports the CDC's recommendation for all Americans to wear masks regardless of their vaccination status. From Washington, Maria Bird, Channel Television News.
Joining us on the situation in the U.S. is Dr. Mercy Dionwe. She's an internal medicine hospitalist doctor there. Thank you for joining us on the program.
Thank you for having me.
All right. I mean, 1,000 deaths per day. Are you worried by the statistics coming from the US, and what would you say is fueling it?
Yes, we're very much worried. Just like the previous video had said, there has been a great increase of rates here in the U.S., particularly in the South. I am a hospitalist, so I deal with patients in the hospital, and we too have had to hold people in our ER rooms as the rooms upstairs in our hospital are completely full. What I think is probably fueling it is two things. There is still that high rate of people who are hesitant to get the vaccine. And the second thing is this Delta variant is very contagious and so has spread like a wildfire in the States.
But there are those we hear are getting, who have gotten vaccinated, but are also getting COVID. So there's also the mask mandate. But how many people are adhering to that?
So here in Texas, where I do reside, because of our politics, our governor has said that, you know, there is no such thing as mask mandate and he does not want to do it. So we are seeing people not as, I want to say, they're not as strongly adhering to wearing masks, but some are. And so I would say there's still a great percentage of people who are still not wearing masks, and that is contributing to our rates. Yeah.
But as a public health professional, what would you advise?
So what I would advise is two things. It's proven that the vaccines help to reduce your chance of getting COVID-19. For example, for me in the hospital, majority of the patients, if not actually all the patients I've admitted that have COVID, are those that are not vaccinated. Yes, as you had alluded to, there is some breakthrough cases, meaning there are some people who are getting the infection despite being fully vaccinated, but there are, I would say, less than 5% compared to 90+% of those who are not vaccinated that are getting the COVID case. So I would say two things. Mask does help prevent you from getting the disease. So regardless of if you're vaccinated or not, please wear your mask. And then the second thing, consider getting the vaccination. I have been I've been working in the hospital since COVID started. I am not seeing any cases of people coming in as a result of a very bad case of a reaction from the vaccine. Yes, you may have some, symptoms that last 24 to 48 hours, very mild. But for the most part, what you're looking for is that immunity against the virus. And that's what's going to kill you, the virus.
And that's why vaccines are important. Thank you so much, Dr. Mercy Adionwe, internal medicine hospitalist, Texas, US. Thanks again.
Thank you.
And the U.S. Food and Drug Administration has given full approval to Pfizer's 2-dose COVID-19 vaccine, becoming the first jab to be licensed in the United States. The vaccine had initially been given emergency use authorization. It's 2 jabs, 3 weeks apart, and now fully approved for those age 16 and older. Here's more of the global COVID-19 update.
India's drug regulator has granted emergency use approval for Zydus Cadila's COVID-19 vaccine. It's said to be the world's first DNA shot against the coronavirus in adults and children aged 12 years and above. The approval gives a boost to India's vaccination program, which aims to inoculate all eligible adults by December and will provide the first shot for those under 18, as the country still struggles to contain the virus spread in some states.
Very good vaccine, world-class vaccine. And it is appreciated that in a record time where we need this vaccine urgently to prevent the emergence of third wave, particularly in the children. So this vaccine would be used in all children above the age of 12. And this vaccine is different from the earlier vaccine, that this has used the plasmid form of the DNA, which is like other vaccines where you have different platforms, RNA vaccine or other vaccines.
The vaccine, ZyCoV-D, uses a section of genetic material from the virus that gives instructions as either DNA or RNA to make the specific protein that the immune system recognizes and responds to.
But once you get to 70%,
Australian Prime Minister Scott Morrison says the country must begin to ease strict COVID-19 restrictions once it reaches higher vaccination rates, as more than half of Australians have been enduring long lockdowns to contain a Delta outbreak.
and we must adjust our mindset. Cases will not be the issue once we get above 70%. Dealing with serious illness, hospitalisation, ICU capabilities, our ability to respond in those circumstances, that will be our goal. And we will live with this virus as we live with other infectious diseases. That's what the national plan is all about, was always about. That's how we designed it, and that's how it needs to be implemented.
You can take a look at our website, channelstv.com. It has the latest updates and a better understanding of the pandemic. You can find several other stories there. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.